Family members or go through the chart to see where she is consciously sitting first?
Yeah, so to see when this change happened, right? So first question we should be asking when you're seeing a person who's confused, so they've got some cognitive impairment, so we know they're not thinking the way they normally think, okay? So that's why you recall that. And we want to know, did this happen all of a sudden, or did this happen really slowly? So how can you tell? So like I said with this patient, how do we know what her baseline was? How do we know how quickly this happened? If the patient really is confused, they're going to tell you everything is fine and it's all good and it's always been like this. Most of the time they're not even going to be aware. It's unlikely if you're confused that you could say, I know I'm not quite thinking right. You know, some people might know that they're a little foggy, but generally they don't know, right? So you need to get that from history, from the chart, from the nurses, from family members, from wherever this person is from. And if you don't know, so you're seeing a patient emerge, brought in by the ambulance, found, fallen down outside somewhere, and you don't know and they're confused, you have to assume it's acute. You have to assume that it is something that just happened all of a sudden, because the causes of that, the differential behind that, it could be life-threatening. It could be an MI, it could be a stroke, it could be multiple different things, right? So you have to assume it's acute if you don't know. That's your default. So Mrs. B again, she has a past history of type 2 diabetes. She's had it for about 10 years. Hemoglobin A1C is at 6%. Her chem strip she checks once a day, and they're kind of between 4 and 8.